Good morning, Oklahoma. I'm Dr. Olivia Richmond, and today you are going to learn about how not to get pregnant because of the new abortion laws. Now, I'm going to do my best not to get political because this is not political. This is medical. This is straight up education. And that is what I am trying. I don't even like that word try. I am doing. Giving you some sex education because I really don't think that the schools, every single school in your state is providing comprehensive, all-inclusive sex education. There's probably some abstinence programs in there. And guess what? You're probably having sex. That's fine, except if you want to stay empowered with your body and you don't want to get pregnant, you're going to have to know how not to get pregnant. So even though the government is just taking away these abortion rights, fine, doesn't matter what you believe. Let's just get down to the basics of the education, medical aspect of how not to get pregnant, regardless of whether you believe in abortion or not. How do you not get pregnant? Let's do it, Oklahoma. So you're having sex, okay? Now let's define sex in a way so that we're talking about pregnancy, okay? Oral sex doesn't count. You're not gonna get pregnant if semen goes inside your mouth. Not getting pregnant if semen, ejaculation, cum, whatever you wanna call it, is going inside your anus, your butt, okay? You're getting pregnant if semen, ejaculation, cum, whatever you wanna call it, is going inside your vagina while you are ovulating. That is the secret component of pregnancy. You have to be ovulating. That's the word of the day, ovulation, okay? So when you're ovulating and semen goes inside your vagina, that is when pregnancy can occur. So two things, what's ovulation and when the hell does it happen so that I cannot get semen inside me so that I don't get pregnant during this time? So ovulation is, so you have two ovaries, okay, down here. So here's my belly button. Ovaries are like even lower. Ovaries over here, one's here, one's here. Then you have your fallopian tubes and then you have your uterus, okay? Your uterus is where fertilization occurs and eventually cells can turn into a baby, okay? It's not a baby right on fertilization. Ovulation is when an egg is released from one of those ovaries. So every month, one egg is released from one ovary or the other. If you're having sex after the egg is released and sperm goes inside your vagina into your uterus, this is when the sperm and the egg can meet. And that's when fertilization could occur. And implantation into the uterus could also occur. That's what ovulation is. It's the release of your egg from your ovary, and then fertilization and pregnancy basically is when it meets up with a spermy boy and implants into your uterus. This is not a baby, okay? We're gonna talk about this. So when spermy boy and your egg meet up, that's fertilization, and that's a cell, okay? It's called a zygote. It's not a baby, it's a single-celled organism. Doesn't have a heartbeat, it doesn't have anything. It's literally, if you scrape off a little piece of your skin right here and there's cells right here at the top, like of this pen, you can't even see it because that's how small it is. That's what this is at this point. So that's how pregnancy starts. When do you ovulate? That's the second question. If you get pregnant when you're ovulating, when the hell are you ovulating, Oklahoma? You know what I mean? You're ovulating 14 days before a period, okay? So you have July 15th and then you have August 15th. And let's say typically a menstruation cycle lasts 28 days. So on July 15th, you get your period, you go through your period, whatever. 14 days before your next period starts is when ovulation occurs, around that time. Okay, it could be day 12, 13, 14, 15, 16. Around that time is when ovulation occurs. And there's a couple ways to know if you're ovulating. Here is one that is helpful. So one really cool way to know if you're ovulating, besides having like an ovulation tracker app on your phone, which is also probably really useful. I've never used one before. One of the ways to tell if you're ovulating is that right before ovulation, your discharge is clear, wet, and stretchy. Like it can stretch. Okay, that's how you know you're ovulating. Right before you're ovulating, that's what your discharge is like. It's like stretchy, okay? Like you could go like this and it would like, it's not gonna break. After ovulation, it gets more cloudy, thicker, and less noticeable. So that's a kind of cool way that you can tell with your own body of when you're ovulating. Otherwise, just remember it as 14 days before your period starts. Around average of 14, okay? Semen can live inside of you for up to 5 days. So just keep that in mind. You do not want to be having sex during that time. So that's about it, Oklahoma. If you are not trying to get pregnant, but you're having sex, but you're not getting it taught in school of how not to get pregnant, and your parents aren't teaching you, and your doctors aren't saying anything, that's a little down low of how not to get pregnant. I highly recommend understanding this process, using birth control, using condoms, because you just don't want to be in that situation where you're pregnant and you didn't intend on it and you didn't want to be pregnant and you're young or you're not financially stable or whatever the case is. You want to be able to have that choice and have that ability to be empowered with your life, and the way to be empowered is through education. So I hope that this makes sense. I'm going through the rest of the states, so if this didn't make sense, my Texas video looks a little bit different, so you can go check out Texas or Alabama or Arkansas, but those aren't out yet. You guys are like number 2 on my list. So peace out, Alabama. Make sure that you subscribe below. I am Dr. Olivia Richmond, where I talk about sex, relationships, mental health. I am making quiet conversations loud.